When someone gets a diagnosis of heart disease, there's a lot of fear, there's a lot of anxiety, there's a lot of unknowns, and it makes individuals really conscious of what am I eating? Is what I'm eating going to cause a cardiovascular event? And I think it's really important to really understand what's going on and then understand the why behind those recommendations, because that's what's going to help empower you to understand your diagnosis and take proactive action so that you don't have to have any complications in the future. The knowledge is power, and that's what I spend so much time with my clients on, because I know that that's what really helps with long-term implementation. I've seen such beautiful client success stories because I give my clients the attention and the knowledge so that they can be empowered in their food choices. There's been many clients who've come to see me who have high cholesterol or high blood pressure or are known to now have an increased risk of a heart attack, whether that's from a high calcium score or these risk factors. And by understanding what they mean and what foods can help optimize them, they get more empowered to take control of their heart health, and then their metrics make them more motivated to continue onwards with their path. Hi, my name is Michelle Routhenstein. I'm a registered dietitian nutritionist who specializes in heart disease prevention and management through science-based nutrition. Navigating the world of heart-healthy diets can be overwhelming, especially with the abundance of conflicting advice out there. That's why I created this session called Heart Health on the Menu, to provide you with clear guidance and help you avoid common pitfalls that can actually be detrimental to your heart health. Throughout our time together in this session, we will explore the remarkable impact that a targeted heart-healthy diet can have on managing and improving your condition. I have witnessed firsthand the incredible transformations that can be achieved through a well-planned heart-healthy diet, and I'm excited to share that knowledge with you. We will discuss the power of a heart-healthy diet, strategies for thriving after a heart disease diagnosis, managing blood pressure and metabolic markers, debunking myths surrounding heart-healthy diets, exploring the role of supplements, and at the end of the session, I will provide you with a practical heart-healthy checklist. Get ready to embark on a journey towards optimal cardiac health. I'm so passionate and love the science behind nutrition because I get phone calls that still honestly shock me. Cardiologists call me and they're like, how did you shrink someone's aortic root dilation? We don't see that in the research. I had a client who came to me after his third heart attack. And when he was going, the doctor was going to put a stent in for the third heart attack. He's like, I can't do it right now. Come back to me. And it was a month and a half, but it got stretched over to 3 months. And he goes into the office, he's doing an angioplasty, and the person worked with me for those 3 months. The doctor went in to put a stent and he's like, I don't need to put a stent in. Like, the plaque shrunk. There's no need to put a stent because your arteries opened up. There's no actual blockage in that spot anymore. And he was shocked. And so the power of science-based nutrition is really sound. You may have heard from doctors, oh, nutrition doesn't really matter, just take this statin. But you have to understand nutrition is a very nuanced thing in that you can't put people in randomized controlled trials and give them personalized nutrition to a large mass of people and then do angiograms and see this plaque reversal or see ejection fractions increase. I've seen ejection fractions increase from nutrition alone from 15 to 65%. And I say this from a nutrition aspect because their medications were decreased in this course of time. In this 9 months where we see this ejection fraction, the heart's ability, the pumping ability to increase with lowering of medications, nutrition has to be the answer. That's the only thing that actually changed during that time period. But doctors want to see nutrition, randomized control trials like a drug. And you can't do that with nutrition. Nutrition is so personalized. There's so many things and there's so many little nitty-gritty details that matter when it comes to a nutrient-sufficient, heart-healthy diet. So I see the power of nutrition every day in my practice, and it makes me so excited to share more and more with more people because it has a true impact on your heart health. And so if you're listening to this and you don't have heart disease, or you have heart disease, or you have a strong family history of heart disease, taking action early is going to be so important for your future. And so I want you to take that little snippet and say, what's one more thing that I can do to improve my heart health today to prevent things from happening? If you're on a statin, if you're on any medication, nutrition still needs to be implemented alongside it. Because I see a lot of people come to me after a heart attack. They've been on a statin for 15 years, but they never paid attention to nutrition. And once they do, they can reduce some of their medications. They're able to feel better, have more energy, and they're also keeping their lives more increasing happiness and more ability to do what they love to do. And so I feel so grateful that I have this ability to help people in the heart health space because it's really a big global burden and we can prevent it and reduce it if we're more proactive. Hi, my name is Michelle Routhenstein. I'm a registered dietitian nutritionist, and I help people optimize their heart health so they can live long, healthy lives and reduce the health anxiety around heart disease. A lot of people come to me scared and nervous and overwhelmed by whether they have a strong family history of heart disease, they've had a cardiovascular event, just something that they are so anxious about because they don't know what to do from there. And I help people guide them to understand what's going on and then to take actionable steps to improve their heart through nutrition and lifestyle intervention. If you're struggling to optimize your heart health, if you're overwhelmed by the information and you're not sure how to personalize this for you, it's important to seek that additional professional advice. I would advise you to, if you have heart disease in your family, if you're trying to work with improving your cardiometabolic health, you work with a registered dietitian who specializes in heart disease. It's a very specific niche that really addresses blood vessel health, heart health optimization. So it's not just general healthy living, it's really focused on the heart. That can really help to evaluate your situation, do a comprehensive evaluation to see what you need to prioritize, how you can implement science-based nutrition and lifestyle intervention to meet your goals. And it also gives you that accountability and support and the ability to ask questions, to understand the why behind these recommendations so it can really help with long-term implementation. When you're looking for a person to help you with your nutrition, it's important that you know the differences between the types of professionals out there. There's registered dietitians like me, there's nutritionists, and there's also health coaches. So your nutritionist and your health coach can be really anybody who's taken a 6-month course, a 1-month course, and they're calling themselves nutrition and health coach because they've learned about general nutrition, about how they can support anyone on general healthy living. They haven't focused in on the clinical nutrition aspect or the science behind these nutrition. So they don't understand necessarily the medical nutrition therapy on chronic disease states. Whereas a registered dietitian like me is somebody who went to college or went for a post-bac and did a clinical nutrition degree. So they got a master's in degree in clinical nutrition. They've applied and sat for a dietetic residency, which is somewhat similar to a medical residency, but for nutrition. So we had to go through the different hospitalizations and exams to make sure that we are competent in all aspects of medical nutrition therapy. And then we sit for a board exam and we have continuing educations that make us licensed or certified to be a registered dietitian nutritionist. So super important if you have a chronic disease that you are seeking a registered dietitian nutritionist. When it comes to being a preventative cardiology dietitian, which is what my title is, it's more of the subspecialty within nutrition. And this is from years. I've worked in over 12 years with varying cardiologists, electrophysiologists, lipidologists throughout New York City in nutrition, in the cardiovascular nutrition space. So this is where I really fine-tuned and delved into my niche of cardiovascular nutrition. So I only see people who have heart disease related conditions or risk factors because that's what I am seeing every single day. So I really have studied and researched and continued to doing that. So I go to conferences for with cardiologists and make sure that I'm up to date on the cardiovascular aspects of nutrition and clinical nutrition when it comes to nutrition intervention.